we are Administration for Children and Families. We are the Human Services side of the house. For those of you who don't know what the Administration for Children and Families does, we basically are responsible for the welfare programs, essentially, TANF, child care, child support, child welfare, runaway and homeless youth, and Head Start. So we truly are the Human Services side of the house. I'm the regional administrator for Region 9, which comprises California, Arizona, Nevada, Hawaii, and the Outer Pacific territories, which a lot of people forget about, as well as a number of tribal governments and tribal entities that we provide services to. And as it was mentioned, I've been the acting regional administrator beginning last January when my predecessor retired. And I was in an acting capacity until a week before the shutdown, when I was officially promoted to regional administrator. So in some ways, I am new to this position. In some ways, I've been doing it for a little while. But interestingly enough, and not full disclosure here, when it comes to open data, I am a complete novice. I'll talk a little bit about it in a little bit, but basically I found out about the whole concept of open data about a month ago when I was contacted by our leadership in Washington asking me to represent them here at this event because they couldn't make it out on the Administration for Children and Family sides, couldn't make it out here because of budget constraints and other things. So they said, well, you are our representative out there. Can you do it? Well, sure, just give me a couple talking points, no problem. Well, the learning curve has been like off the charts steep, but a part of my being present here during this event has been really beneficial. Yesterday especially, I learned a lot about the whole open data concept, what the process is going, and I had a chance to talk to Brian Civic yesterday. I said, well, Brian, this is not trickling down to the regions yet. We don't know what our involvement is. And he looked at me, he said, we know that, but you'll be involved, and we're going to be talking about that shortly. I said, well, okay, that sounds good to me. So again, while I think in hearing a lot of the discussions that have taken place, it's been clear that within HHS, the health side of the house has been involved in open data. Human Services side, not so much. So I did get some information from our folks in DC about what we've done, what ACF has been doing around open data. I just wanted to briefly, and I mean briefly, describe some of the things that we've been doing. So since our involvement, ACF has become a leader in making the human services accessible to public via the users and stakeholders on healthdata.gov by providing numerous data sets. And initially there were something like 29 data sets, and I don't even know how many there are now. I know that the goal was to increase that. I know on the HHS side broadly there were over 1,000 data sets. And I know that our program offices that are contributing the data sets include the Administration for Native Americans, the Office of Head Start, the Office of Family Assistance, which operates our TANF program, the Office of Child Care, the Office of Child Support Enforcement, Office of Community Services, which is the branch, part of our agency that provides LAHEAP funding, low-income energy funding, as well as Community Services Block Grant and Social Services Block Grant, as well as the Office of Planning, Research, and Evaluation, OPRE, which is involved in a lot of the things that ACF broadly does in terms of research. And as a part of the Health Data Initiative, ACF basically created a team. And currently, the team includes liaisons from all of those offices that I just noted, as well as some offices that are not quite as familiar, Office of Refugee Resettlement, as well as the Administration for Children, Youth, and Families, which includes the Children's Bureau, and that's the child welfare side of the house. So currently, the team is composed of approximately 18 liaisons and their counterparts. And basically their charge, as I'm understanding and as they're explaining to us, is to advance ACF's efforts to support data transparency and the implementation of policies directed at access and to the use of the federal data sources, to act as our data liaisons and provide feedback to Brian and his group on data liberation efforts and issues or challenges that were faced in these activities, and to identify ACF's high-value data sets that are highly sought after by the public or known to contain data important to continued or improved delivery of health and human services. I think the thing that struck me in seeing and hearing all of this, as I said recently, is that we have the potential, ACF has the potential to be on the vanguard of integrating the human services and the health data at HHS. We've got that health services data. And I think we can forge the connection between health data as well as the social determinants of health. We had that presentation yesterday that talked about it, that's kind of outlined out there on the back board. ACF still, I believe, we still have numerous untapped human services data sets that can be identified and described and cataloged on healthdata.gov. And I believe that we can also be a key partner in communicating the role of human services data and disseminating it broadly, not only to entrepreneurs, but to you folks, to state governments, to county governments, tribal governments, and to the general public. I will say, though, to date, these efforts have been mainly focused on our central office activities in Washington, and they have not really included the regional offices. And for those of you who don't know our structure, we have 10 ACF regional offices across the country in the usual suspected places you would think, the major cities, Chicago, New York, Atlanta, Philadelphia, San Francisco, Seattle, Denver, Kansas City, and Dallas. So there's an opportunity for the regional offices to really get involved with this as this moves across the country and this whole emphasis on open data really becomes a reality. It's my hope that we'll continue to be involved. And I was struck by something yesterday, the discussion about the use of open data. Who could use these data? And I cut my teeth as a program specialist in Head Start, and then in child care, and then was a program manager, and now I'm the regional administrator. And I can tell you that every step of the way, if I had had those data available to me, it would have really helped not only my work with my constituency, with the grantees I worked with, but also with my colleagues. Because it would be very easy for me to then approach a colleague and say, we have these data that show that our shared population has these characteristics, and how can we work better together to help solve their issues. And for all of the discussion we talk about sharing information across government and trickling it down to states and locals, I mean, it should come as no surprise that it's sometimes very difficult for us to get out of our silos as a federal government and go over and talk to somebody else, even in our own agency, about how we can collaborate and coordinate our program together to make that outcome better for our shared client. So I'm hoping that with the open data, as we move through this, as it trickles down from Washington down to the regions, that message will continue, and it will basically help us down here at the regional office level, because we're the ones who are basically working with the states of California and Arizona and the other states and trying to work through their process as well to help basically the outcomes for the end client to be much more effective. So the challenge that I see is going to be for us to work with the leadership, us ACF, to work with leadership in Washington, D.C., to identify how ACF can accomplish some of these things, how the regional offices can be involved in this, how the folks who are working with you on the ground can really translate that information so that it's meaningful. Because I see the open data piece as helping not only state administrators, state directors, state commissioners, et cetera, but also our folks in the territories, our folks in the tribes, and basically also making that available down to the community, so that those community members can access information and identify, as we were speaking yesterday, identify where they can go to get their information, where they can get their services, so ultimately their outcomes can be improved. So as a part of that, my reactions basically, I think I was mentioning last night when I was having various conversations at the reception that, to me, late to the party, late to the game, it seems to me it'd be a total no-brainer. I don't see why we haven't done this before. And I basically have told Brian that, and I've told other folks in our leadership that this sounds like a really great idea. And now that I'm a convert, if you will, I think I'll be able to use that position, and going forward, there are a lot of priorities, a lot of things that ACF is working on right now, but this certainly should be a main priority. And I'm going to try and push forward as much as I can from my position. Not that I have not that they're going to totally listen to me, but at least I would hope that by talking with my other colleagues across the country, my other regional administrator colleagues, and alert them to this information, that we as a group can kind of say, hey, okay, central office, now you need to start moving this down to the regions so we can be a part of this, because I believe it's very meaningful and very important. So in summary, I really look forward to being a part of the continuing efforts that everyone's doing here, and that I can be as much of assistance as possible to any of you, all of you, and that I really do appreciate the opportunity to attend, to be becoming a convert, and I look forward to the rest of the day to learn more things. Thank you.